hearing was originally. Joining us today are Katya Seminova, Special Counsel for Policy and Legislation for the Public Defender Service of the District of Columbia, and Lindsay Appiah, Deputy Mayor for Public Safety and Justice. As you know, it is the tradition of this committee to swear in all government witnesses who appear before it. Ms. Seminova, I'll ask if you can take yourself off mute and raise your right hand. Do you swear or affirm under penalty of law that the testimony you are about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth?
Yes.
Thank you very much. I'd like to now invite you to make any opening statement that you may have.
Thank you. And I'm testifying on Bill 250537. Good afternoon. I'm Katerina Seminova, Special Counsel for Policy and Legislation at the Public Defender Service for the District of Columbia. PDS supports the district taking a whole government approach to public safety issues and to public health. Rising crime rates, community fear, and despair are not the product of a lack of personal accountability, nor are they about the failure to detain, prosecute, and incarcerate more members of our community. As PDS has repeatedly testified, the public safety issues facing the district today are the result of failures of district agencies to help and protect the very individuals and families that they are supposed to serve. Families and youth have not recovered from the pandemic, and the end of pandemic-related financial supports has only exacerbated the problems families face. Executive agencies that have systematically failed to address the needs of the district's most vulnerable residents have avoided responsibility for those failures. Instead, the mayor has repeatedly called for more incarceration and detention as a form of accountability inflicted on traumatized youth and families who cannot access the resources or services they need to thrive. There's been almost no focus on the root causes of crime and only haphazard implementation of the strategies that experts have detailed in report after report as the necessary pathways to building strong and resilient communities. The district knows the root causes of criminal system involvement for youth and emerging adults. In 2020 and again in 2022, district mandated reports by the CJCC concluded that system-involved youth have experienced significantly higher rates of homelessness, poverty, school disruptions, and abuse, while economic stability was a protective factor against system involvement. Half of all children with juvenile system involvement have had contact with the abuse and neglect system through an allegation of neglect. Youth who are system involved become emerging adults who are system involved, and then all too often become adults who face insurmountable barriers to reentry. Supporting the family systems that support these young people and emerging adults is essential. CJCC's root cause analysis noted, quote, uniformly, interviewees stated that prevention efforts must target supporting and improving family capacity. They said that efforts to help youth are limited unless the efforts also address deficits in the youth's home environments. They explained that family and home environments have a tremendous impact on the development and behavior of young people. Thus, efforts to support youth are most effective when they address underlying challenges within their environment. Improving family capacity requires squarely addressing housing instability and insufficiency, barriers to employment, and barriers to access to medical and mental health care. In the district, the burdens of poverty, unsafe housing, and insufficient employment fall most heavily on Black residents and other residents of color. In 2022, median family income in Ward 3 was 7 times greater than the median family income in Ward 8. When DOC reported jail population by ward in 2016, just 0.2% of the detained population lived in Ward 3, while nearly 30% came from Ward 8. The incredible disruption of poverty in the district's race-divided poverty, where white families have a net worth that is 81 times greater than that of Black families, has not been effectively or meaningfully addressed by the district. The failure to support families and vulnerable individuals is responsible for the manifestations of public health problems, from truancy to violence to unemployment to juvenile and criminal legal system involvement, and require a whole government approach. The district spends $620 per child per night for detention at the Youth Services Center, but provides less than $1,000 per month to families through TANF. Instead of shifting those priorities, the mayor is building 10 new beds at the Youth Services Center while refusing to fund an increase to SNAP benefits that was passed by the council to address rising food costs. If the increase to SNAP is not funded, 145,000 individuals, meaning 22% of the district, will be denied this funding. On top of this, the district's Department of Health and Human Services is last in the country for its speed of processing SNAP applications. 55% of children in foster care, meaning children who are under the legal responsibility of the district's Child and Family Services Agency, are chronically absent from school. This is not how families and youth are stabilized or supported. PDS appreciates that this bill highlights the need for a whole government approach. The whole government approach should focus not just on crime. It should address how the district can help communities, individuals, and families thrive. In May 2023, the mayor ordered deputy mayors to provide the city administrator with recommendations for a whole of government approach to crime reduction. Deputy mayors had 45 days to complete the recommendations, and to date, no recommendations about what all district agencies will do to improve community circumstances have been broadly shared with the public. The council should demand production of those plans. Two provisions of this bill that will be particularly helpful as part of a whole government strategy for community improvement. First, Title I of the bill requires the Office of Neighborhood Safety and Engagement to produce performance metrics for violence interruption programs. There is currently little transparency regarding violence interruption programs that are supervised by WUNS. The website for WUNS states that WUNS has contracted with 3 community-based organizations and 1 subcontractor to provide violence intervention services at 22 sites. The map tool on the WUNS website does not show the locations of the sites and instead lists participating wards. There is no information about how a community member could contact one of the sites by phone or by appearing in person. There's no information about how many individuals are employed at each site and the hours that they work. Further, under the current violence intervention model, the WUNS office, which since May 2023 has not had a permanent director and which had no director for nearly 1 year from February 2022 when Del McFadden resigned to February 2023 when the mayor appointed the sadly now deceased Linda Harley Harper, has outsourced the development of the neighborhood interruption plan to each of these contractors. It's not clear that WUNS has any role in ensuring that sufficient staff are hired or in ensuring the quality and scope of the outreach. This should be of particular concern to the council because the DC auditor reported in 2021 that violence interrupters were spread too thin. 8 of the 22 priority communities were served by only a part-time violence interrupter. 4 communities were served by a single violence interrupter, and 1 community was served by a floater, which the auditor noted concerned anti-violence leaders who expressed the belief that no single individual can make a meaningful difference in neighborhoods that have experienced severe, persistent violence. Meanwhile, sites in Baltimore and Chicago each had at least 3 or 4 violence interrupters and additional case management. The council passed the NEAR Act that mandated the creation of WUNS in 2016, but it takes years to reap the benefits of violence intervention programming. The benefits that the district should now be seeing in terms of violence reduction have been deferred time and time again because of a lack of investment and commitment. Thus, while this legislation focuses on metrics, a critical first step is also transparency. There should be transparency about what the WUNS office has done and failed to do with respect to violence intervention work. The council should demand public-facing engagement and that WUNS create clear ways for individuals to access services. One of the metrics that should be included in this bill is the number of sites operated, the staffing plans at each site, and how the public engages and learns of operations. The Gun Violence Strategic Plan also recommends training for all violence intervention workers and the hiring of returning citizens in violence intervention roles. Adherence to these recommendations should be included in the reported out metrics. PDS also wants to highlight our support for Title III of the bill, which would create a Director of Emerging Adult Services housed in the Office of the City Administrator. The Youth Rehabilitation Act Strategic Plan, which was commissioned by the district and delivered in 2022, recommended creating an executive position that focuses on the needs of emerging adults. The need for this role is clear. Emerging adults, meaning young people ages 18 to 25, are overrepresented in the criminal legal system. They make up 10% of the total population in the district, and yet men under 30 account for nearly 45% of the male population in the Department of Corrections. Directing particular attention to this group makes sense. Emerging adults need support and guidance to progress into successful adulthood. For emerging adults, at the same time as they face incredibly complex, difficult life circumstances and other new pressures such as parenthood, the prefrontal cortex, the area of the brain primarily responsible for logical thinking, decision-making, and emotion and behavior regulation, commonly referred to as impulse control, remains under development. As a result, emerging adults are more prone to impulsive behavior, more sensitive to immediate rewards, and less future-oriented, more volatile in emotionally charged circumstances, and highly susceptible to peer and other outside influences. Further, exposure to trauma, which is a universal circumstance for youth in the district's poorest communities, further delays brain development and exacerbates emotional dysregulation. Families that are financially sound and that are not responding to constant trauma and the threat of violence meet the needs of their emerging adults by sending them to college, helping them apply for internships, and continuing to support them by managing their medical and dental care, co-signing leases, etc. Emerging adults who come from CFSA, where juvenile system involved, and who come from families without these same resources and levels of support need the district support in making the transition to adulthood. Given the district's racial wealth gap, this mandate is one to support the district's Black emerging adults and people of color. This bill's implementation of this key recommendation of the Youth Rehabilitation Act strategic plan is laudable. As the strategic plan noted, quote, a district-wide strategy is necessary to provide community-based support and programming for all emerging adults. This is consistent with the NEAR Act goal of taking a public health approach to public safety by using community programming to prevent legal system involvement for emerging adults. The position is also needed to help break down any existing barriers to service or agency cooperative actions and to provide a single point of contact, evaluation, and oversight as it relates to the implementation of the YRA. This provision also works to address a consistent criticism of the functioning of the district government, that we are resource rich and coordination poor. The needs of emerging adults are well known, but program implementation has consistently lagged behind those needs. In 2018, the YRA required a continuum of developmentally appropriate community-based services for emerging adults, covering the areas of education, workforce development, behavioral and physical health care, housing, family, and reentry needs. The YRA strategic plan noted what the district should already know from the numerous plans and reports commissioned over the last 10 years. Quote, incarceration is not the solution to addressing crime, public safety, or community violence, and should not be the presumptive response to those issues. Community interventions, programming, and treatment provide opportunities to address issues of accountability, rehabilitation, and affect lasting positive change for all legal system involved individuals, including emerging adults. Community-based programming is less expensive and has better outcomes than incarceration. After years without meaningful progress, and in fact, a deterioration in services and support, this position could create the coordination and programming that emerging adults desperately need. This position could also make progress in addressing this condemning assessment by the National Institute for Criminal Justice Reform. Quote, the district is unique in that it is one of the few cities in the country that has the needed talent, ability, and resources to drastically reduce gun violence in the city. However, it is lacking the political commitment, coordination, and a coherent strategy to reduce gun violence. Thank you for this opportunity to testify, and I welcome any questions.
Great. Thanks so much, Ms. Seminova. Deputy Mayor Pia, welcome. I'm just going to go ahead and swear you in, and then we can hear your statement as well. If I can ask you to take yourself off mute and raise your right hand. Do you swear or affirm under penalty of law that the testimony you are about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth?
I do.
Thank you. Please go ahead.
Good afternoon, Chairperson Pinto, members and staff of the Committee on Judiciary and Public Safety. I'm Lindsay Appiah, Deputy Mayor for Public Safety and Justice. Excuse me. Today, I'm here to provide executive testimony for Bill 25478, the Improving Safety and Emergency Response on Transit Corridors Act of 2023, Bill 25483, the Safe Commercial Corridors Amendment Act of 2023, and Bill 25357, the Whole Government Response to Crime Act of 2023. As you've repeatedly heard from the executive all year, reducing crime is the Bowser administration's highest priority. Mayor Bowser has emphasized that to advance the safety in our system, we must work to restore balance to our public safety and justice ecosystem. And that includes filling any gaps we've identified. To that end, the mayor introduced two critical pieces of legislation, the Safer, Stronger Amendment Act of 2023 and Addressing Crime Trends Now Amendment Act, aimed at reducing crime by giving law enforcement and prosecutors more tools to hold criminals accountable, creating an environment that better supports communities and victims, ensuring the Metropolitan Police Department can hire and retain highly qualified officers. We look forward to council moving these pieces of legislation forward. We're also committed to working with council on additional legislative and policy proposals that will make the city safer and putting every necessary resource towards public safety and turning the crime trends. However, we must focus on proposals that will not detract from agencies carrying out their core functions by adding additional administrative burden that will not lead to crime reduction. I'll now turn to the bills being discussed today. First, I'll begin with B 25-478, the Improving Safety and Emergency Response on Transit Corridors Act of 2023. The executive is committed to partnering with council to reduce crime and increase safety. However, this proposal has operational deficiencies, implementation gaps, and anticipated fiscal implications that the executive cannot support as introduced. The nexus of the legislation is to improve public safety on and around public transportation. However, this proposal bypasses the district's transit partners, which not only maintain law enforcement authorities on the buses and trains, but already operate their own robust video surveillance system, which is used today to combat crime. When it comes to operationalizing and implementing the proposal, DDOT would not be the appropriate agency to recommend locations for system placement or evaluate whether those systems increase safety along those transit routes, as this assessment falls under the subject matter expertise of law enforcement and would most appropriately fall to WMATA. DDOT would provide consultation support to DMPSJ. However, their consultation role will be focused on identifying potential utility or permitting conflicts associated with installing video surveillance or emergency communication systems. When it comes to the reporting proposal, the proposal requires DDOT to submit a report on the results of the program to council. However, the information needed to develop this report is mainly aggregated by law enforcement, primarily Metro Transit PD. When it comes to video systems in other public spaces throughout the district, MPD currently maintains closed circuit television system with more than 300 cameras. And Mayor Bowser is committed to doubling the number of cameras over the next several years. Additionally, the executive believes MPD's new real-time crime center will help fill gaps this proposal is attempting to address. And certainly one of the partners in the real-time crime center will be Metro Transit PD. Lastly, the proposal directs DMPSJ to conduct a study on the prevalence of violence and crime at bus stops, train stations, and other public spaces in the district. DMPSJ is not best equipped with personnel or expertise to conduct this study and believes this responsibility would better be suited for a body that facilitates information sharing and collaboration and conducts research and analysis. Second, I'll discuss Bill 483, the Safe Commercial Corridors Amendment Act of 2023. The district's commercial corridors serve as public gathering places to meet and interact with neighbors. These locations provide local services, generate jobs for residents, and create a sense of neighborhood identity. Additionally, our neighborhood commercial areas provide a significant source of revenue as they're destinations for retail and commerce. Increased teleworking has kept large number of office workers, residents, and visitors away from major commercial corridors. And concerns about safety have also impacted the cohesiveness of commercial corridors in the district. As a result, a reduction in foot traffic in these areas has disrupted retail, hospitality, and arts and entertainment venues, as well as safe community interactions. Through the fiscal year 2024 Budget Support Act, the Safe Commercial Corridors Grant program was established by Chairperson Pinto to award grants to promote public health and public safety activities in 3 designated commercial corridors in the district. This proposed amendment, which the executive supports, expands the program to allow these grants to be distributed district-wide. Of note, DMPSJ recently issued the request for application for fiscal year 2024 with applications due January 12, 2024. Finally, Bill 25-357, the Whole Government Response to Crime Act of 2023. This bill creates a host of new data reporting requirements, task forces, and work groups and positions within PSJ agencies. While the executive supports comprehensive solutions, we're concerned that the proposals contained with this bill will not lead to a safer city, but will divert critical agency resources away from the work of reducing crime. I'll turn to a few areas of concern within B 25-357. First, while the executive supports transparency and data sharing, we do not support creating onerous reporting requirements such as those related to gun recoveries. MPD currently posts on a weekly basis gun recoveries with locations by block, as well as aggregated data on a regular basis. It's unclear how posting disaggregated locations collectively or or number of firearms recovered disaggregated by, if available, manufacturer, firearm model, state of country of origin, and last known point of sale, transfer, theft of loss will reduce crime. Having to produce a report with this data will certainly divert critical agency resources away from other work to this task. While the executive recognizes the potential value of analyzing the type of information, it is a moment in which we must focus on what will have the most immediate impact for our communities and evaluate the value of adding onerous tasks on top of those agencies like the Metropolitan Police Department already have. Additionally, this bill proposes the creation of several advisory and working groups. The current reality is that there are already a significant numbers of boards, commissions, working and advisory groups. Establishing quorum in many of these bodies is challenging because the vast number of these groups consist of many of the same entities. At a time in which we should be going back to basics and streamlining our efforts, the executive does not support creating a host of additional bodies. Instead, it would be prudent to evaluate what existing structures may exist that could perform some of the tasks within the proposal. Finally, the executive does not support staffing matters in the manner in which it has been proposed. An example is the creation of a victim services coordinator within OVSJG to, quote, work with OVSJ leadership and staff on the implementation of the hospital-based violence intervention program and coordinate with HVIP members to ensure a coordinated response to victims' needs. The coordinator shall collaborate with the MPD Victim Services Branch to ensure a coordinated response to victims' needs, end quote. The district has long had a hospital-based intervention program funded by OVSJG. We've also had the Crime Victim Hotline that provides basic crime crisis intervention support and helps callers access the complete continuum of care for crime victims, including relevant and appropriate resources based on the needs of the caller. The Family and Support Services Office at the Office of Neighborhood Safety and Engagement also is intended to serve as a direct link between survivors, immediate family member, and government and community-based providers, and ensure connections to a broad spectrum of services and supports. Creating brand new positions to do duplicative work will lead to confusion and will not enhance service delivery for victims. The executive recognizes the need for a whole of government response to reducing crime, but we believe that this is a time in which we must work to avoid unintended consequences that will bog down our system, rather than allow us to focus on the way that we must to achieve positive outcomes for the safety of our residents and visitors. As we close calendar year 2023, I want to say thank you to the more than 10,300 employees that represent the PSJ agencies. These agencies serve as national leaders in their respective fields, and our community benefits from our employees' subject matter expertise and professional experience. I'm also extremely appreciative of district employees that partner with PSJ from across government to support reducing crime. I also want to thank the public witnesses that appeared last week. I was sick, sorry for not being there. And the community members that have shared their perspectives this year about how public safety is impacting them. We hear you. Share your desire to see our youth excel, families thrive, and communities in all 8 wards both be and feel safe, and are committed to working together to make these goals a reality. Thank you for the opportunity to testify. I'm available to answer any questions you may have.
Great. Thank you so much, Deputy Mayor and Ms. Seminova, and thank you both, to your teams and to you both, for being here so much this fall. We have had a hearing almost every week of this fall legislative session, and I really appreciate all of the time and effort that it takes you and your teams to come and be here before the committee, and your expertise means a lot in our legislative process, and so thank you. I want to start with you, Deputy Mayor, about your comments about the transitway system. And so I heard you talk about some kind of operational and cost concerns, and when you mentioned the CCTV cameras, one of the concerns that we hear a lot is the quality of the footage, whether that be blurry, not in real time. And so can you talk about how the real-time crime center could fill that gap as you defined it, described it, as opposed to having these types of cameras in transitways?
Yeah, so one of the things is we've been kind of going across the country this fall and looking at best practices in intelligence gathering and in real-time crime monitoring. I've seen with myself, I was in the JOC, right? Like on the day of, on a recent day, and there are varying levels of, quality of camera. I will say that Metro Transit has some very good, like I would say, there are varying qualities of camera. One of the things the Real-Time Crime Center will do, in addition to updating, ensuring we're updating our CCTV with whatever is, on a schedule that's recommended that will allow us to have the highest quality, will also give us access to both camera systems that many businesses have, right? Like one of the things is that I yesterday met with the bid council. Many of our bids and the businesses there have very good external cameras that we don't always have access to. And the platform that we're going to will allow all of that to be integrated into basically a comprehensive platform, not internal cameras, nothing that's surveillance, but external, while also working too with our partners at Metro Transit and our federal partners who will give us access to external cameras so that we are able to have better footage. There's also, of course, a number of entities that private cameras that also will be able to give access through this integrated platform that's used in over 200 entities across the country. And so what we think is with that will give us a lot of much more than what is currently available in basically our 300 CCTV, which is relatively limited.
Okay, and when you mentioned the meeting with the bid councils, we heard from some of our bids last week from public witnesses that they could really use more of an integrated system, especially quick response when there are incidents going on. And there was some testimony about previously having some MPD coordination, but needing MPD's buy-in. So where are you on that?
Yeah, so that was something particularly our Georgetown corridor mentioned, that there previously was a platform. It was whatever. What I've said is that both because we are moving in a more coordinated real-time crime way, that this is the absolute right time to have that conversation. Chief Smith is completely committed to us working together. There were suggestions made that were very, very helpful that I said I would take back, and I'm fully on board of this more integration with our security personnel, right? Because some of the concerns that were expressed in the previous iteration would be addressed by a more targeted. And so what I would say is that having met with them, I'm fully on board. Chief is fully on board. And so we're moving that forward as we're working with our businesses on this rollout.
Okay, so is that not something that you think you need, or that you do need legislative authority to do? You have the tools right now to get that coordination off the ground.
That's correct.
Okay, and then just when it comes to this kind of blue light idea, part of the theory is that we need to have quick response, as opposed to having a victim of an incident have to pull out their cell phone, call 911 when something is an emergency, especially at our bus stops that may be lower trafficked areas, or it's late at night, very dark, and not everywhere is as well lit as others. And so I'm worried that while I'm enthusiastic about the real-time center and the updates there, that not trying out an alternative approach with this type of blue light model could still leave those transit riders vulnerable in low traffic areas.
So we're not opposed to it. We just honestly think that it might make more sense for it to be aligned with WMATA, right? So that it's not disconnected from whatever they're doing at transit centers. So really, this is some of the things that you hear me say, and you'll hear, is making sure that we have operational alignment in the right place. And so DMPSJ and DDOT likely are not necessarily the right entities. As we're kind of in this process of what's the best way to enhance safety, it's an idea. We're willing to explore any idea. It's just important that it's in the right place. And so what I would say is that before legislating this, that we would want to have conversation really like we're having now with WMATA. And the other thing is, I think people think we currently real live cam monitor. We don't in the district. So there's also that is a component of what we're moving to that would help us in some of those more where we know there's more challenges at certain to take a look. But we're happy to have those discussions. We would just say that we want to make sure that everything that we do is in the right place.
Right, okay. Well, thank you for that feedback. I appreciate that. And, one of the other things we're thinking about with these blue lights is to put someone on notice that you are on camera. If you're thinking about, doing something illegal. So let's move on to the safe commercial corridors. Thank you so much, for you and your team's effort on getting this pilot standing. I know there's a lot of enthusiasm in the corridors that it's in on these applications. Can you talk about some of the metrics you're considering with those applications, when the funds can be expected to be actually out the door in the community? And I do want to just say, for folks who have been following along on this, because I've gotten some concerns from folks of this pulling away from MPD. This is absolutely not instead of MPD. This is a supplement for commercial corridor safety.
Sure. So one of the things that we did is we spent some time with DEMPED, right? Like as well when we were moving in this direction, because there's a host of ideas that people can propose. So some of the metrics obviously are crime. Like I always, somebody asked me yesterday, like, what are the metrics that we look at? And is there reduced crime, right? Like, so that's, kind of a key one. But some of this is dependent on the ideas. There is a host of different ideas that people have, even just meeting with all of the bids yesterday. So if it's a staffing, okay, is this enhanced staffing helping to add presence? Is there this is a harder one to measure, but a greater sentiment of safety? Do businesses feel better supported in the safety space? Is there better coordination? And some of that's measured by contacts or otherwise. Those are some of the things that we'll be looking at, and it's kind of dependent on what the proposals really are. But we had a joint session with DEMPED with, anyone who wanted to participate to offer up some so that we're aligned, because there's so much being done on the economic development side. So making sure that we're aligned across the space on some of the things that could be helpful with security assessments and, if there's going to be apparatus purchase or staffing ideas around. So with that, so it closes January 12th, and I'm sorry, I don't know off the top of my head. I can give you what the exact review period. It's relatively quick, and so we can anticipate probably in the early part of next year. Like I don't want to, I'm like looking over here because I don't want to say out of turn, but we recognize the urgency and we want to also give people time to appropriately spend. So it closes January 12th. We'll make a decision relatively quickly because it's a relatively small number of quarters. And so I can get you like the timeline that we laid out in the RFA and otherwise.
Okay, and then this bill before us kind of expands the pilot so that it would qualify commercial corridors throughout the entire city. Are there any implementation challenges with expanding the program, given you've already come up with the metrics and the application process?
I think the only thing would be like administrative capacity, and DMPSJ itself, like we're, as the hub, kind of we're a relatively small office, right? Like, and so as we add kind of larger or the larger numbers, then there's the administrative pieces of making sure we're good stewards, auditing appropriately, checking. But otherwise, I mean, with the RFA established and otherwise, we'll have I don't think there's a whole lot to be done there. And we're working closely with our bids. Yesterday, like I said, I met with the bid council. Anacostia bid, for instance, has some great ideas that fall right in line with the RFA. So I don't foresee large challenges there other than just kind of like the administrative of lift of some of what's going on in PSJ or DMPSJ, my office.
Okay, well, thank you for that. And, hopefully we can get this passed, and I'd love to see it funded even in the supplemental budget so that we can get more of these funds out the door. And I know this is kind of a new area for DMPSJ, but part of what I hope to be the effectiveness of it is that there can be that follow-up coordination if the entities who are benefiting from the grants can have that follow-up collaboration with your cluster on additional security needs they may have. So thank you for getting that off the ground. I'm out of time for this round, and I'll turn to my at-large colleague, Councilmember Robert White, for a 10-minute round.
Thank you very much, Chairperson Pinto. Thank you so much for being with us. Deputy Mayor Apaya and Ms. Seminova. So focusing on the whole government approach to crime response, I think something that most of us know is that no one person has all the answers on how to make our city safer, and we have to kind of think through and debate these things. I understand your testimony from the frame that you laid out at the beginning, that the administration's position is that we need to fix the balance in the system. My underlying philosophy is a little different, which I think explains the approach of my bill. I believe that in order to make our city safer, we have to fix the parts of our public safety system that are broken. Last week, I used the analogy of a kitchen sink. And so if your pipes are corroded and leaking, no new parts are going to help you until after you fix those pipes. And so right now in our public safety system, the 911 system is not working well. Department of Forensic Sciences is not working well. Agency coordination is not working well. These are, in my opinion, the leaky pipes. These are the holes in our public safety system that are causing crime to spiral. So that's why I focus on where the gaps are. Your testimony suggests that some of these gaps don't exist. Let me start with victim services. This year, I spoke to a mother whose son was shot in 2020. He was transported to the hospital for emergency services. Very fortunately, her son survived, but the trauma that it's caused him and his mother are ongoing, not surprisingly. She shared with me that the process to get help was confusing and frustrating, and she had wished that there was a person that connected her to services and helped her navigate the various stages of the process. Last week, at the first part of this hearing, we heard from a public witness who submitted, we got testimony from a public witness who submitted written testimony about a violent robbery that she experienced this summer. From her written testimony, she wrote, quote, "I was attacked around 3:05 p.m. and finally got home after 10 p.m. that night. And I realized that during all of that time, not a single police officer, EMT, or medical professional mentioned the availability of victim services or support. And I was given no written information in my voluminous hospital discharge papers." This witness, end quote, this is an attorney of 20 years who works in the criminal legal system, suggesting that if she is having difficulty navigating, then I would add, if the mother whose son was shot and taken to the hospital is having difficulty navigating, they can't be the only ones. In your testimony, you're saying, well, we already have these services. So what is the gap? What are these folks missing that you're saying exists now?
So I would say that then that's an education issue, right? That we've created a front door. And if the front door is not one that people know they can walk through, then it is our responsibility perhaps to do more public outreach, to ensure that all of the stakeholders, whether it be those who interact at the hospital, not just HVIP, but those at hospital personnel, that whomever along the way, prosecutors or others, understand that we have the crime victim hotline, right? And that if they're a victim of violent crime, the information goes to, or of gun violence, goes to family support services. And that if there's a gap where people don't know that that's where they're supposed to go, that we fill it by ensuring that our residents know that. And then we can see if there's a challenge with those entities that are responsible. That's a different thing than there not being, that there needs to be one person. Unfortunately, in our city, we have a significant amount of people being victimized, and we would never be able with one person to connect them to all services, which is why we created a hotline as an aggregator to try and to bridge that gap. I don't think many people know that. We also have a complex system where crime victims' compensation under the court is often what people are looking for and not what we have available. So this to me seems like what is most necessary and appropriate is information and figuring out how we are better communicators about the host of resources available, and the case management that's even available in the crime victims hotline to those who are any person who is a victim of a crime in the district.
So your position is that we can fix the gaps in the system through public education?
I think that we can identify what the gaps are by first ensuring that people know it's available, because when they say there isn't anything available, that lets me know that we haven't made it clear where they do go. We haven't made it clear across employees, across all of those who may touch victims. And that means there is an education component that needs to happen before we decide what the gap is.
Okay, so we agree that there's a gap, and we agree that services exist, but are not coordinated as well as they should be. What we disagree on is whether the answer to that is public education or a coordinator.
I didn't say that whether or not they're as coordinated as they should be. You mentioned 2 stories in which individuals really didn't know what was available to them. That says to me that if there is a gap, first it's to start with information about what's available, and then we can determine if there is some other gap in how services are delivered or otherwise. But the first thing would be in making sure people know where they go, and that everybody who touches victims understands to direct people to this front door that we have already created.
I think a coordinator accomplishes that, but happy for us to disagree on the solution. Now looking at the firearm tracing part of the bill, the number of firearms recovered in DC has been on the rise for years. This year, nearly 900 people have been injured by a firearm, and 200 of those, over 200, were fatal. The process that I'm suggesting in my bill is something used by Chicago, California, Massachusetts. All these states are doing firearm tracing reports. This is based on this recommendation. That's part of the legislation is based on recommendation from ATF, Brady campaign, and Everytown for Gun Safety. You're suggesting this would be a sort of a waste of resources. I'm suggesting if we have a better idea of where, we know that a lot of guns are coming into the city. If we have a better idea of where they are coming from in particular, we could do a better job of stemming that tide. What am I missing? Because other states are doing this. ATF, Brady is saying this is the right way to go, and we know we have a gun problem.
I'm not saying that whether it be that it's a waste of time. I'm saying that the Metropolitan Police Department collects a host of information and provides this publicly. This talks about producing a public report, which isn't the same as whether or not the information's available and that it's a part of the process of law enforcement, and that we work with ATF on tracking and figuring out the best way to address that. What I'm saying is that all the places you've listed, I would say that it's very likely that the Metropolitan Police Department produces more public reports for council and others than all of those combined. And that if we're going to add another task of creating a report to publicly post, that we consider the administrative efficiency, because what I'm saying is that the Metropolitan Police Department is reduced in numbers, both civilian and sworn, and that if we're going to take analysts or others off to continue to add to reports, then we need to figure out what's going to best help us to reduce crime and gun violence. So I'm not saying whether the information is valuable. Certainly the Metropolitan Police Department, like all others, likely works with law enforcement entities to address these issues. The question is whether taking the time to compile it in a form that can then go to a public, what is the purpose? What do we want? Because there's a trade-off in people right now. So that's what I would say.
Okay. So, we in Ms. Simeonova's testimony was something she mentioned that the district is resource rich and implementation poor. You're suggesting we compile a lot of information, but I have a hard time finding it. Folks that we meet with have a hard time finding it. I've not been able to find that this information is centralized even for MPD. But it does seem that at some points we have to not be stuck on sort of the aftermath. And at some points we have to start looking at the sources. Where are these guns coming from? Let's take a focused look. There may be things that we're producing that aren't worthwhile. I don't know. That's something that I think you and your team hopefully are auditing. But this information seems very valuable for getting to the source of guns flowing into our city.
And we know the source of guns flowing into our city because the Metropolitan Police Department works in the I-95 corridor with ATF and with other law enforcement entities tasked with stemming the flow of guns into our city. I'm not saying whether or not it's valuable for them to continue the law enforcement work. I'm asking, what is the value in compiling this particular, another report to post publicly? If there's data that people are looking for that will help us, we're happy to do that, but we have to ask when we're turning them to doing this. There is always a trade-off. So we need to ask very carefully before adding more administrative tasks to agencies, what will be the impact on operational outcome? Because that matters critically right now.
Well, if it's already being collected and produced internally, it doesn't seem like a big step to make it public. So I don't know that this is a huge strain on resources, if you're saying it already exists. I am over time, but I think we may have another round. Is that correct? Excellent. Thank you.
Yes, we will do another round. Thank you, Councilmember White. So let me pick up there with the firearm tracing data. So this provision was included in the July emergency bill that the council passed to require firearm tracing, and that report is due in January. And so what is the concern with continuing that data collection, especially in light of the unique need the district has, and the effect that we receive from guns flowing in from other jurisdictions, to continue tracking this so that we can employ our other strategies around lawsuits for manufacturers, around figuring out what we need to do at a federal level, what we need to do with our regional partners in tracing at a granular level, where all of these firearms are coming from.
Because every time, so the Metropolitan Police Department is going to abide by every law that's put before them. But when I run the number of reports that are required by council for MPD to produce, not for the purposes of helping them with police work, but instead to either inform the public or otherwise of things which it's not clear how that reduces crime, which is what we need them to focus on. I'm not saying they're not doing the policing work, but we have to ask, what is the trade-off? So they are spending a lot of time to put things in a format that's palatable for other people to understand versus what they may have that they work with the ATF that helps them to operationally do what they're doing, which is tracing where firearms flow into the district. You hear us all the time say where the number one places are for firearms flowing to the district because we know, but that's different than taking time for analysts who could be working on intelligence gathering to create a report for council and others to post on a website. And I'm not trying to be, but that is the trade-off right now, is to every time a new report is added, we don't have additional people, right? We don't have additional analysts that we can just add, that we have to use the people we have. They're taking a lot of time for reports that we don't know how that's going to help us reduce crime, it helps them reduce crime to produce a host of public reports.
I hear you, Deputy Mayor, on the large array, and we try to be very conscientious of the strain on resources for these things, but we have not been able to get a handle on the illegal firearms flowing into the district appropriately. And so having a better sense also for police to look on an aggregate basis to say, these are where illegal guns are coming from. What more can we do to prevent that flow from coming into the district? I guess just don't see why that piece. I get you on the larger, many different reports, but this piece, as we try to use every tool we can to combat the flow of illegal firearms in the district, seems like a sensible one.
Is there a reason? So I would posit that there are ways to communicate that don't require people to create special reports that are not operational for them. So if there's things that are needed that people believe would be helpful, we could have a conversation at an operational level of what's available and how to best give that. That's not what really happens sometimes here. These are the things we think based on other states or others without necessarily an appreciation for how our system compiles information or otherwise. So I would say that if there's thinking about what we then will do, right? Like we're going to charge. I also think we have to be realistic about what's going to happen in our jurisdiction. Are we going to have strict liability for gun manufacturers? It is unlikely. I'll just be honest. Right now, that's not where we are. We have lost Heller a couple times here in the district. So what we're saying is right now, before imposing new operational requirements or more on very taxed agencies that have less people, right? People resources and that have more to do because we have to reduce crime. We have to think about what the outcome will be.
Right, okay. I'm gonna move on just because time is clicking, but thank you for that context. Ms. Seminova, I want to ask you about the position for emerging adulthood. You testified about your support for this, but can you speak about PDS's experience in working with emerging adults and what kind of service gaps you're seeing?
Yeah. So there are a lot of service gaps. Those service gaps we discussed them at the hearing as well on youth behavioral health needs. So some of the gaps, the largest gaps, are in services that should be being provided by DBH. So it's in mental health care, it is in access to providers, it is in access to and really fidelity to the ACT program or the ACT model of therapeutic supports. There are real deficits in housing across the sort of the spectrum. So permanent housing, transitional housing for youth and other people who may be transitioning to a placement outside of the district, but who have to be here supervised under CSOSA until their supervision can get transferred. There's a lack of LGBTQ housing. There is huge gaps in housing, huge gaps in mental health services, in the types of providers available, in the depth of services available. And then there is this position would work not only with legal system involved young people, it would work with individuals in that age bracket who are particularly vulnerable because of their development. And so it is what the council has heard repeatedly is that there's a lack of connection for those individuals where there's a perception that you need to be in DYR, you need to be somehow connected to DYRS in order to get services. So it's really being proactive and getting services there. I mean, deepening jobs programs, deepening education related to jobs programming as well.
Okay. Thank you so much for that. And I want to lift up this 211 referral system that I hope can make a real difference in these referrals prior to somebody being justice involved. I appreciate you articulating that. Deputy Mayor, you've talked about, I don't want to put words in your mouth for this particular program, but you've said a lot in your testimony about, not duplicating efforts and like not reestablishing something that's already existing. But I had a hearing yesterday with the Committee of the Whole on truancy and absenteeism that I was very disheartened by. And we were talking about students in the care of DC coordinating committee. And it was stated that they have not held a single meeting in 5 years since it was established, which was also a legislative mandate. And so I don't know if you have a response to that particularly, but it's this concern of we stand up things and sometimes things shouldn't be mandated legislatively, but when we do, we're still not seeing the action that we need. And so as we think about additional tools that we can be an appropriate partner with the government, what are we to do when we see these groups not even meeting and doing this important coordination work for these vulnerable populations?
Yeah, so I would say that just because there isn't I've worked closely with former Director LaShunda Hill on discrete issues and across, right? Like, so we had a standing meeting with DOC, DYRS, and students in the custody. Now, those were on specific issues related to young people in custody to ensure that we were filling educational gaps, with OSSI to make sure that we were creating, working on MOAs. There's difference between these working groups, task forces, and others, and the fact that as agencies and others, we have to work together. So what I'm saying is that because we have limited bandwidth, that every time you create a new position or task force or otherwise, it doesn't actually enhance operational efficiency. What we're looking for is outcomes. So you're talking about, for instance, truancy, a discussion that the city administrator convened us as deputy mayors at our level with our relevant agencies to talk about what we need to do legislatively, operationally, clearly what we're doing isn't working. You don't always need a coordinator, particularly in the office of the city administrator, which quite frankly is removed from agencies and is not operational. What we need to do is oversight, that we have responsibilities and we work together across cluster in a host of ways. There are a lot of issues. And so there are times where it's an overwhelming number of issues, and that's just a fact. That's not an excuse.
Hold on. The city administrator is not operational? That is
No,
the
what I
one
mean-
word I would use to describe.
No. What I
the
don't mean that.
administrator's function.
So for clarity, that placing someone in this office, they are oftentimes research or oversight. When I say operational, the agencies are tasked with executing. That's a fact, right? So if you're saying that we need more behavioral health or others, it doesn't always actually create that by putting a position in the office of the city administrator. And he'd say that it's that we have a responsibility as deputy mayors. That's just a reality to make sure we are working together strategically and that our agencies are then coming together in a coordinated function. And that really is our roles and what we're trying to do now, rather than creating other bodies that don't have the ability to move agencies to action necessarily, right? Like if you're not, they don't directly report to a coordinator in the office of the city administrator. They do. They report to us as deputy mayors. We report to the city administrator. So if there's a challenge, figuring out why that's the challenge versus creating another body is what I'm saying now, because really some of what you're seeing is we don't have more housing, but we have to figure that out, right? Like we have limitations in behavioral health, but we have to figure that out. And I know I'm over, but I would say when it comes to emerging adults, honestly, the Office of Neighborhood Safety and Engagement was created for the 18 to whatever population that we were seeing involved, particularly in crew-based violence, because DYRS had young people who were up to 21, right? So you have 21, and then that overlap of when a young person commits an offense over 18 to whatever age it may be. So there were these bodies that there's an interplay of who really pathways was intended for, right? Like, or otherwise. So I say like, we're kind of, the needs are not different if you're formerly or currently system involved, but out in community, 18-year-old working in pathways with ones, and someone who might be sentenced under the YRA. So the question is, how do we make sure that the bodies that exist are like focused on these very challenging issues like more behavioral health?
So what you're saying is I need to conduct stronger oversight over you?
Yes. Yes. What I'm saying is you don't have to create. Yeah, that is what I'm saying, is that I have a responsibility to come before you to explain what's going on, so that if we create policy, that you don't get frustrated because we're not conducting these groups. But I can tell you, with all of these task forces, CJCC exists and otherwise, if you look down them, it's the same people, and we don't have the bandwidth to also do all these task forces and operationally make sure we're doing our jobs.
Okay, well, let me just ask you finally, and forgive me just one more moment, Councilmember White, about metrics collection for once. Because notwithstanding what happened in the last 5 years, last year when we were in performance oversight, talked about ones needing time to get their sea legs and put the infrastructure in place. We are now another year in.
Yes.
And I hear you saying we don't need additional legislative mandates. So how will your office work with ones to identify performance metrics, including the inputs and outputs and short-term and long-term outcomes that actually are measuring the efficacy of these programs, especially for VI, for Pathways, Leadership Academy, and the Emerging Adult Initiative? So
we have those because, quite frankly, right, like there was a mayor's order ordering us to look at metrics. And as I said before, we do measure. I could give you a report on what we are measuring for VI, and then ones does produce during performance hearing. They're much more of an input or touches and otherwise. So we have a host of data. I will say to you that, unfortunately, with the passing of Director Harley Harper, a lot of things happened come May, but to the extent you're asking what metrics should be measured, happy to provide those, because we did the work of even meeting with CURE or otherwise, because we were required, DMPSJ, as part of the process you heard of in the mayor's order, to look at all the reports that have been done since really 2006 on the district, and what are the proper metrics, including those from NIJCR and others for VI programs. And so I'm happy to provide those of what we are holding ones accountable to, and the data that they should be providing. It is taking time for them to get to the point where they're posting on the website, but in terms of provision to you or otherwise, like, we're accountable to provide that, and I'm happy to provide to you what metrics.
So are you done with that review then?
Yes.
Okay, well, that would be great, and the committee would definitely appreciate that, as soon as possible.
Happy to-
Okay, Councilmember White, please go ahead.
So much. Deputy Mayor, could you provide the metrics at the hearing? Like, can you tell us what they are?
Yeah, I mean, well, there's a host of them, because what we did was, like, it's not just once, it's credible contact programs. So for instance, we looked across Credible Messenger, VIs. It's not, all VIs aren't the same. And so let me pull up some of
So
them.
they have different metrics, each of them.
There are some that are the same, but there are
Okay.
some, because of what the programs are, there are different things you should be measuring. But there are some that are base level that, you know, if you looked at the NIJCI report or anywhere else, those are the metrics. They don't change. And we don't disagree that those are the proper metrics. But I'm happy to, I don't want to take too much of your time to pull them up, but I'm like.
All right, I'll work with the committee to
Okay.
get them. I appreciate it. So let me know for the public, I know you know this, Deputy Mayor, but when the council requires reports or task forces, the budget office works with the agency to understand the cost and personnel required, and we have to add that money to the budget. So we're not sort of putting upon agencies without providing funding. For the emerging adult director, DC government commissioned the Justice Policy Institute to develop alternative methods for responding to legally involved emerging adults, so people ages 18 to 24. JPI published their recommendations in 2021 for the mayor. And this position was one of those recommendations, the position that is established in this legislation. Let me start with Ms. Semyonova. Based on your experience with young people in the criminal justice system, how would the Emerging Adult Services Director improve interagency coordination or increase support for emerging adults?
I think, I want to start with something that Deputy Mayor Pia said, which is that there are people in the agencies that are supposed to be doing things, and that it's a question of oversight. There are people in agencies who are supposed to be doing things, but those things are not getting done. And so the coordination, the care that people need is not being provided through DBH. It's not happening. The services that individuals need to come home are not happening. And so there needs to be somebody who is focused on making sure that these agencies are providing what they need to provide to individuals to help them thrive, to help their families thrive. So it is what I mentioned in terms of housing, mental health care, physical health care, somebody who can be at DOC and help individuals who are going to come home, to help them have a provider available when they leave. There needs to be much greater transparency in terms of waiting lists, available providers, what services are available, who's available to give them, when can they start, and much more of that sort of wraparound care that is necessary. And so a coordinator would be able to interact with these agencies and then also receive information from individuals who need care, receive information from their social workers, from their lawyers, from other advocates, and the individuals themselves, and see those gaps, and then make sure that those gaps are being filled across agencies. So it's a critical role, not a defensive one where an agency says, we're already doing this, or call this number that doesn't have providers and where there are waiting lists, but rather one that directly can interact with individuals and have a much closer understanding of what gaps are and how to fill them.
Deputy Mayor, so the plan recommended that I mentioned in my question, that the mayor create a staff position or agency to coordinate implementation of district-wide response to address the needs of emerging adults. Currently, how are services for emergency adults coordinated among different agencies like DYRS, MPD, DOC, ONES, DOS, MORCA, and other education agencies?
I mean, it really depends on the status, because when you say emerging adults, you talked about a population 18 to 24, and they all have different statuses. I was a part of that process, right? Like, I was very much a part of the JPI process. And the conversation I had with Mark at the time was that creating this in OCA, I said, well, and Clint Lacey at the time was a part of this at the start and actually commissioned it, because we thought, hey, this is probably the right place is DYRS, right? Because they're already helping to create comprehensive, taking a look at young people 18 to 21. Is an 18 to 24-year-old that vastly different than the 18 to 21-year-old who is committed to DYRS? It's unlikely. That was our recommendation. So I hear the recommendation that was made, but I would just note that we said, if we already have an entity that's tasked with looking at young people who are system involved in some way, is there a vast difference between, right, like the 18-year-old who may be in the adult system and the 18-year-old who may be in the juvenile system? I don't know that that's the case. So I say that there because this is, again, about our recommendations around alignment. I throw DYRS there because a lot of the comprehensive wraparound services that must happen have to happen for young people in the juvenile justice system. And one of the best ways to do that is we want to be aligned with our fellow agencies. And I think that, DYRS has to do much of that same work in that kind of alignment. But the other thing is that we are able to add resources then if they need to contract or otherwise. The need for DBH or housing or these things is great. And so we're always, you know this, you're over housing, like that's a challenge, right? And it certainly is for emerging populations. So I use it as an example of when we're talking about alignment of agencies that are already sort of operational in nature and have an expertise, perhaps these are the places we can put them, despite what recommendations from others may say. So I would say that there are different ways coordination done. One thing Ms. Semenova talked about is those at DOC. Well, the reason that we wanted a physical location, which we just opened for the Ready Center, is for co-location. So if you go to the new Ready Center in Ward 8, there is full-time there, someone from DBH and DHS and also from DMV, right, to actually physically take people's ID.
Right,
so,
but the Ready Center is a different population. It's a broad.
I only point that out because she pointed out having people at DOC, and some of those reentry or other for 18 or any other age, right, like is done there. But I don't want to take your time. Sorry.
Okay, but what I missed, got a lot of good information, but I didn't understand who is or who you recommend should coordinate the services.
I mean, my coordination of, again, like when we're talking about emerging adults, right? Like there are different populations of emerging adults and some of them aren't system involved. So who are we talking about? But I would recommend, right, like that if we're doing alignment, we already have an agency tasked with providing comprehensive services for system involved young people from 18 to 21. And perhaps the wisest thing is to have them look at 21 to 24 because there isn't a vast chasm of difference.
Okay, so nobody's coordinating right now is what I'm hearing.
I didn't say that. What I said is that you're talking about people in very different categories with different needs. Some have case management through DHS because that's their need. Yeah. Some may have coordination because they are through DOC. Some may be DYRS involved.
But so this is like a common thread, right? For violence intervention, for emerging adults, for victim services. Again, back to Ms. Semenova's statement, resource rich. We got a ton of programs. But then when you start to try to drill down and say how are they coordinated, there's no coordination. And so it is inevitable, undeniable that we are duplicating and sort of wasting resources and that there are gaps in our system. And we have all these things that taxpayers are funding, but they're not coordinated. So there are massive like gaps in our system, which is what I'm trying to fix. And you're saying, don't fix it this way, but but these things clearly are not coordinated, and they have to be. They just have to be. So the mayor issued a mayor's order this year that required relevant agencies to submit a plan on their violence reduction efforts. Council held a public roundtable in October about the results of the mayor's order. The auditors also urged the executive for more data collection and transparency. I've asked for better data and coordination of all violence reduction efforts. Do you have a standardized performance metric for violence reduction programs?
So that's a very broad category that you're talking about when you say violence reduction. So, no, we don't. But what I would say is it's that the reduction in violence, right? Like, which can be measured in lots of different ways. But when we say violence reduction, you'd have to be more specific, because that could be defined as primary, right? Which is reduction, law enforcement. It could be tertiary, things like housing or mental health. So you'd need to be more specific about which violence reduction programs you're talking about.
I just wanted to briefly respond on DOC. So my point was that at DOC, there is not an individual from DBH who sits with clients and says, you're going to need these services when you are released to the community. I'm going to help you set up those services. We're going to get you appointments with these care providers. You are going to have an appointment. You're going to have an intake. And then the following week, you're going to start, or the next day, you're going to start regular treatment, regular meetings, regular treatment. So being released from DOC and then going into the community and then being at Morca or being at the Ready Center and talking to somebody from DBH and then learning that there's a wait list and learning that there's a list of providers. That's an entirely different type of care than having somebody coordinate the next step from leaving DOC. And that's what I was referring to, is this need to take this next step. And I think we spoke at last week's hearing, I believe it was last week, perhaps 2 weeks ago now, at the roundtable on youth behavioral health and the deficiencies of DYRS in providing services for this very same population. So that a population where there is overlap. And you heard from all the people who said that there was this lack of services and lack of coordination through DYRS for this population. So giving them an additional responsibility is will not fix that gap, or will not create that coordination that's already lacking for the population that they are meant to serve.
I want to thank you both, and thank Chairperson Pinto for reconvening this important hearing. I know I'm over time, so thank you very much.
Thank you very much, Councilor White, and thank you for introducing this bill so we can have this discussion today. And I appreciate you both, Ms. Seminova and Deputy Mayor Pia, being here. And as I said, for you and your team's continued involvement and engagement throughout this heavy legislative fall, as we keep working to move forward proposals that we really believe will make a difference immediately for public safety and improving public safety, and also be sustainable over the long term. So appreciate your continued partnership and for the productive conversation today. That concludes the business before our committee today. The time is now